Thanks, Professor Chen. And I'd like to thank the organization and especially Professor Li giving me this opportunity to report our some works in the omega fatty acid in treat of depression. To understand the psychoneuroimmunology mechanism of the treatment, I'd like to quickly introduce the brain and the immune communication. It's a very interesting story. We start from the 30 years ago. So we can see brain through the 3 ways to control immune system, the neurotransmitter release, and the HPA axis activities, which can produce cortisol, we know the stress hormone, and another is the sympathetic and parasympathetic. Recently years, the vagus nervous system, they can invade the immune system. So 3 of them can modulate immune function. On the other side, the immune cells like the macrophage in the peripheral and the lymphocytes, and they can produce pro-inflammatory cytokines or chemocytes and acute-phase protein and other kind of the immune modulator to pass the brain-blood barrier and directly combine their receptor in the hypothalamus and the neurons. So through that way, the brain and the brain communication. During stress or the adverse event in the life, also the immune disease such as the inflammatory disorder and autoimmune disease, both brain and immune during that time communicate, and they can cause the immune disorder or the cognition problem. So in the brain, they're more interesting. We can see there are 3 different cells. It's not a neuron: microglia, astrocytes, and oligodendrocytes. 3 of these cells actually decide the fate of a neuron. It's not like we focus the 100 years, all the disease is the neuron problem. It's not true. So all those cells actually maintained or damaged the neuron function. So quickly to see the microglia. Microglia, when activated by the peripheral immune response, they can go to the several directions. One is the download break down the tryptophan to quininic acid, so reduce the serotonin in the brain. So one is the symptoms of depression. And then in the other side, microglia produce the inflammatory cytokines and the chemocytes or the inflammatory mediators, also the oxidates, so which can significantly damage the neuron function as well. And in this green one, the big guy, this very important cell, astrocytes. Astrocytes produce the anti-inflammatory cytokines. Also, the most important is the neurotrophins. And the neurotrophins can support, repair, and nourish the neuron. So the many functions of both of them interact in the brain. And this, the last one we study still very little, is the oligodendrocytes. This can make the myelin under the neuron, the special axons. So 3 of them interact in the brain, especially during the stress and immune diseases. They can change the function of the neuron and go to the depression direction. So why we choose omega fatty acid? Because the previous knowledge we indicated inflammation could be the trigger for depression. So if we, through those slides, we can see when we reduce the inflammation, we enhance the astrocytes neuron trophin function, then probably is the best way to treat depression. So then the omega-3 fatty acid is mostly from the seafood, and their end product is anti-inflammation. However, omega-6 is from meat and vegetable oil, which is produced many inflammatory modulator. So our current the food intake, the omega-6 is 21 times higher than omega-3. So we are body really short of omega-3. That's why we have more and more inflammatory kind diseases like skin problems, allergies, arthritis, and autoimmune problems. So we need to take more omega-3. And we can see 3 enzymes work on both fatty acid. So if we add omega-3, then we can move this direction from the omega-3 to suppress the omega-6 production. So in that way, we can increase the body, the anti-inflammatory effect. So in the past 20 years, my team worked on the omega fatty acid, especially the EPA. And because those fatty acid is the membrane component of the immune cells, also the brain cells. And we found that they treated depression is quite effective. In the FDA already listed the EPA as the depression supplement, which I produced the most the clinical, preclinical data. Here is clear showed the correlation between among the omega fatty acid ratio 6 and 3, depression symptoms, and inflammation status in the patients. And we can see omega-6, more omega-6, and positively correlated with the high omega-6 ratio omega-3. And this with the highest depression symptoms is the 18. So this very clearly more inflammation come from maybe from the high omega-6 than positively with the higher or highest the depression symptoms. So similar the omega, another TNF-alpha, which is also the pro-inflammatory cytokines, have the same pattern, and the omega-6 receptor also positively correlated with the higher omega-6. And let's see the omega-3. Omega-3 have the opposite pattern. Omega-3, more omega-3, less the depressive kind of symptoms, and less the fair questionnaire score. So we can see that's just exactly what I talked previously. And in the depression patients, recently study found the white matter, the neuron degenerated, which could be is the oligodendrocytes I mentioned was disordered through the microglia astrocytes interaction caused the oligodendrocytes, the function is become lower. And so we can see the white part is impaired in depressed patient. After several weeks, usually 6 or 2 months, we can see the white matter is recovered very significantly. So in the past 20 years, the clinical trials tried very hardly. We can see so many trials. And mostly about 90% is positive favorite to the omega-3 can treat depression. However, including the recent several report, not including here, find the omega-3 fatty acid didn't work for depression. So what is the reason? We can see here have the 3 different combination. If there's a higher DHA in the treatment, then the fared for the clinical trials. So this is very clear to show like EPA, higher EPA or EPA dominant the treatment will be more effective. So why like that? We created several experiments. So one is recently in the clinical work with the collaborator with the Guangzhou Medical University, Aihui Hospital Institute. So we just, the time limit, we just pay attention to this blue line. The blue line is the high EPA, and the another is the high DHA, is the, it should be the A, number A is the red one. And then we can see the EPA much more effective after 12 weeks compared to placebo, or the DHA is much more effective in the clinical treatment. And then we designed an experiment to compare EPA and DHA in the animals model. This animals model induced by chronic, unpredictable, mild stress. Then this model has been very popular, used in the recently the depression study. This slide is showed from several points we compared both treatment. One from the HPA axis, the cortisol and the neurotransmitter changes, and another from a microglia exercise point of view. So microglia correlated with the inflammatory cytokines release, and exercise correlated with the neurotrophins production. And then we measured the neuron apoptosis in this study. And the bottom table just showed after 8 weeks treatment, the changes in the fatty acid profile. We can see decreased omega-6, increased omega-3 in the treated the group. The previously, the other speaker already mentioned those behavior. First one is the sucralose intake. So sucralose is kind of avoiding the sugar water. The animals usually like to drink it. But we can see the depression model, he didn't like it. And then the immobility, which is in the first swimming test or terror suspension experiment. In those experiments, the animals give up behavior is increased, the second column. And then we can see the animals in the bottom is another, the number of animals going to the this anxiety-like behavior in the bottom for the open field. And then this one, the raining score means the exploration. So we can see the animals showed all the depression-like behavior, such as reduce the sucralose and increase the give-up behavior and decrease the exploration and activity. So those are all significantly reversed by EPA. Only DHA only have 1 or 2 effect. Mostly is EPA is much better. Then we checked the cortisol and the cholesterol, the concentration in the brain. We can see the cortisol level is increased in the depression model, also the cholesterol, and this all relief decreased by the EPA treatment more effectively than the DHA. And in the bottom, then we measured the animals, the apoptosis gene. The BAX is the apoptosis gene, and the BCL2 is the anti-apoptosis gene. So we can see the BAX is increased and the BCL2 decrease, and which also better to reverse by the EPA. But the DHA also work because DHA has the function to nourish the neuron, which is similar to previous study. Then we measured the related to the exercise function and the like microglia exercise both functions. Microglia, the marker CD11B is increased a lot. That's correlated with the increase the bottom pro-inflammatory cytokines. This is consistent with the microglia pro-inflammatory response. And then the exercise marker BDNF is the GFAP decrease, and correlated with the BDNF and the other neurotrophins such as GDNF and NGF. And those are like a glial growth factor and neuron growth factor and the brain-derived neuron trophins. They all decrease in this animals model. And we can see clearly EPA is more effective than DHA to include those changes and suppress the immune response. So to further avoid answer the second question, if we take the omega-3 fatty acids, would they will be interact in the body, in the guts, and or in the brain, interact with other material? Maybe they become secondary or some metabolite things. So how about we get some animals model which can produce omega fatty acid in the brain? So then we are lucky we got this model. It transit the fat one. So these animals can produce omega fatty acid inside the brain. Then we use the model called olfactory bacterial mice rats. This model is created by my supervisor in the PhD in Ireland. And we work on this model for 30 years. And it's very interesting, this model can mimic all the changes for the depression patients we can see from the behavior and the neurotransmitter and the immune and the endocrine system. They all similar for those changes. So in those animals, in the fat one animals, we did OB surgery and we did sham operating and we see what happened in those animals. Then the similar, we did the sucralose gene taken and we can see the OB animals have less the sucralose taken, and it's reversed in those fat one animals. Then we can see the social interaction. This is quite interesting because we know the depressed patient doesn't like to interact with a stranger. So the result is yes, we can see there with the stranger, the interact much lower. And then in the fat one, they go back to normal. And also the duration is decreased in this model. Then they go back to normal as well in the fat one animals. Then in the open field, which is the very good indicator for obese behavior, those animals, because the limbic system got damaged during the olfactory bulb removal, so those animals showed a very hyper activity in the novel stress environment. Then this because the noradrenaline, the leakage. So those animals showed a very hyperactivity in the open field, and it's normal in the fat one animals. The below also the activity running, and we can see the style of the moving here. Animals, when they depressed, even they walk. The distance travel very quick, but you can see they are hardly going to the center. They are afraid they stay in the wall. In the fat one animals, they almost normal the behavior. So the neurotransmitter also changed. Serotonin system is weaker, is downregulated, and the noradrenaline system also downregulated. And both this is reversed in this fat one animals. Then we further try to understand the lipid metabolism in these four groups. And we can see clearly they are separate the metabolites very clearly. The first one here, the B, we can see compared to the sham operation, the OB is red, the metabolites in the right, and the sham operating in the left. Their metabolism totally different. And the second, the C also is the OB with the fat one OB. So fat one OB is still like in the right, but the depression the one in the left. And then we compare to the white type sham and the white type and the fat one sham. We can all see four of group is totally separate, clearly the different pattern of the lipid metabolism. And this is to be the time limitation. I just don't say too much. And totally we find about 15 the serum metabolism in the lipid analysis. And inside of these 15s, there's a very interesting some of the changes. So in those OB animals, the microglia activity is increased, same as the other depression model. And we can see the TNF-alpha, interleukin-6, and the IB1, this is the microglia marker. So they are significantly increased, both CD1 and IBA1. This both, the bottom is microglia hyperactive. And the top two is the pro-inflammatory cytokines. So these all indicate the inflammation from peripheral and neuron or changed in this depression model. And however, it's very clearly very effective in the fat-1 animals. They are nothing, the inflammation no happen at all. Then we find the pathway of the lipid metabolism, 3 enzymes. So these 3 enzymes in the lipid pathway metabolism, they all changed in the OB animals, but we can see in the fat one, they are quite higher expressed to promote the normal lipid, the metabolism. So in the last experiment, I feel the most exciting is we find 2 lipid abnormal lipids. One is the PC. More PC in the blood, they have less the abnormal behavior, and higher COPE, and with the hyperactive depression kind of behavior. So then we think the COPE must be related to the inflammation. Then in this experiment, we choose the COPE to incubate with microglia cells. Then we find microglia cell and also co-culture with neuron. So the first, the figure showed the one COPE combined culture with the neuron. They showed suppressed the neuron viability. But however, when the co-culture with microglia, we can see the oxidates and the pro-inflammatory cytokines. They all significantly increased in the COPE, this collaborate in culture. So this is clearly indicate in the blood there is one at least the lipid called COPE. This can directly suppress the neurons' cell viabilities, but stimulate awake the microglia function. So then this is probably the reason is caused depression. Then omega fatty acid can reduce these changes. So in conclusion, doesn't matter is treatment or endogenous omega fatty acid, they all can attenuate depression-like behavior and neuron pathological changes, which may relate to the restored lipid metabolism, lipid metabolic pathway, and suppressed inflammatory response. So thank you for your attention. Thank you.
Okay, thank you, Professor Song. Any question?
Yeah. This is the place I'm working now. Have very good genetics, protein, and metabolism analysis. It's the building very beautiful in Shenzhen. So welcome you to collaborate with us.